Hello, good evening, and welcome to tonight's edition of Beyond the Lockdown. From July 4 to July 12, 2020, Ghana has... Thanks for staying with us here on Beyond the Lockdown. You're welcome back. We'll get straight into action tonight, and like I said, we have the Information Minister, Kojo Nkrumah, joining us amidst the rising cases. Some have asked, is it time for a review of our strategy as a country? Is there even a plan B? Is the question. Welcome, Mr. Nkrumah. I hope you're doing well. It's been a while since we had you on Beyond the Lockdown. You've been missed. Okay. Well, I hope you're doing well.
I'm well.
But where is the president?
The president is at the presidential villa of the Jubilee House. In fact, just about an hour and a half ago, I got off a Zoom call with him where he was interacting with ourselves and our communications advisory team. He continues to stay away from the general public as part of his 14-day exercise. I think he's left about 5 more days or so to go, if my calculation is correct. He's hale and hearty and is going about government business while observing the COVID-19 protocols that have been put in place. Okay,
so I have a copy of the statement you issued a week or so ago about him going into self-isolation.
Yeah.
You mentioned then that he had tested and he was negative.
Yes.
Has he tested again, and what's the result?
I do not know whether he has tested again, but the last brief I have is that his test came out negative.
Okay, so you said at least one person in his close circle.
Yes.
Who is that person? Could it be more?
I cannot put out names, okay. But I do know that at least one member of his security detail tested positive. And that is why this precaution had to be taken, because he then became a contact of this person who had tested positive.
Are there others?
Yes, there are a number of other government officials. I'm sure you have heard from the Honorable Dan Bocho, you've heard from the Honorable Matthew Poku Prempeh, you've heard from the Volta Regional Minister. There are a number of persons who have tested positive, who have voluntarily come forward to announce their positive state. Some of them have recovered, some are undergoing treatment. Senior Minister Yao Safumafu is undergoing treatment. He's at home currently. Last time I spoke to him, he's still at home, and he's also hale and hearty. We continue to encourage persons who test positive to help by stepping forward and saying so that it helps in fighting the stigma associated with the condition.
The president at any point in time travel out of the country for medical assistance?
Absolutely not. Those are fabrications that have been thrown out there by persons who seek to do these things for their own, and we believe, political benefit. There's an audio tape purporting that the president was in Kenya and speaking. That's a total fabrication. There were stories put online by one newspaper that he had gone to the UK for tour. That's a total fabrication. I think you're on your screens right now. This is the president in a Zoom call with us just about an hour and a half ago, dealing with a few communication matters. He's been in the country throughout. He continues to be here and goes about sorting out his briefs and attending to documents and doing video calls and telephone calls with ministers and other officials who he needs to interact with.
Okay. Well, so if he's positive, would you tell us?
If he's positive, we would tell you, because the president has been at the forefront of asking people to speak up and help fight stigma. The president was the one who spoke about the health minister's positivity and wished him well. And if you follow his addresses, he has been speaking about the need to break stigma. If the president was positive, we would have to put it out as part of fighting the stigma associated with this. But he's not. And that is why we have, right from the very beginning, been proactive with information that he was going to stay away for about 14 days. That is why I think his office, after today's Zoom call, for example, has even put out a video of him happily going about his business.
Okay. Well, I know a number of questions will come regarding this area, but I would quickly go into the story if it seems rushed, because there are a lot of issues that we need to deal with you on.
This is beyond the lockdown.
Of course, it's beyond the lockdown. So the issue of our strategy, I'll quickly touch on that, then we can get into questions from the audience as well. Who is in charge of our COVID management strategy as a country?
There's the Presidential Task Force on COVID-19, which task force is chaired by the president himself. He has a number of advisors on it, made up of epidemiologists, public health experts, infectious disease experts, security persons, and people drawn from the various facets of society that are required in dealing with this. In the end, that strategy is owned by His Excellency the President. He has had time and again an opportunity to explain that 5-part strategy to the country, and we continue to provide updates on where we are on that strategy, the results that are coming through, where we are having successes, we share with the country, where we are having challenges, we share with the country and request the necessary assistance. So yes, He is in charge of the strategy.
And is he satisfied with the strategy that has been implemented as we have it?
I think the results of our strategy are clear for everybody to see. It ought not to be about whether the president is satisfied with it or not. What have we sought to do as a country? One was to, as much as possible, limit the importation of cases into the country as far back as March, at the time when knowledge about this virus was very limited. And the knowledge at the time said that what you have to do is to screen for symptoms. Ghana was one of the first countries to roll out an elaborate screening mechanism around our borders of entry. Subsequently, we, as part of that surveillance program, introduced a very quick testing regime. So even at the time that we were surveilling, testing started. It was as a result of that the first two cases, the index case plus one, that very first night, somewhere around 11 p.m., when testing proved that they were positive, we quickly engaged the country to say that what we have done so far in terms of delaying or preventing importation of cases into the country, success so far, this is where we are, but we have had two who came in asymptomatic, passed through the screening, could not be detected, but who subsequently have been caught up by the testing mechanism.
I ask about satisfaction because are we doing as much as we used to do, so much that you pride yourself in?
Well, if you let me go through, I'll hit on all of those ones. Now, the second matter on our scope of items was to ensure that we contain community spread. We are having today significant community spread. And time again, we have had opportunity to speak about why we are having significant community spread and enlist the support, the citizenship, not the spectatorship, the citizenship of Ghanaians to help us deal with that community spread. Because community spread is not something that you can legislate against. It's not something that you can, at the press of a button, stop. It requires the entire community action to resolve it. Item number 3 was to ensure that if people get the condition, we will, as much as possible, give them adequate medical care so that mortality is low. Today, look at our numbers, about 135 persons who have sadly passed on, and take that as a percentage of the positive cases we have had. And that is why the analysts who look at the numbers say mortality rate in Ghana as compared to many other parts of the world is low. But we are not saying that because mortality rate is very low, one of the lowest, it's kumbaya yet, because we still have other things to deal with. For example, we have said that though we acknowledge that the world is in short supply of logistics, we also need to manufacture a good number of logistics here to help us fight. Else, the numbers of positive cases that you're seeing could even get out of hand. Look at what the doctors and nurses are telling us. Imagine what the situation would have been if we had not introduced that pillar of even producing some of the local items and doing what some of the countries even in the West did by saying it's in short supply, it's in short supply. And then finally, we've also been trying to mitigate the socioeconomic impact on our people. Now, if you take each of these 5 parameters, you can clearly tell that we have made significant success. Where we have a challenge is containing community spread, which requires the entire community's support and action. And if you followed the government engagements with the nation in the last week, that is where we are hitting and enlisting everybody's support in ensuring that we are able to curtail those numbers as much as possible. So briefly,
at what point do we say that there's a time for a change in strategy? Because it appears that it's unidirectional. People have asked whether there is even a plan B as a country.
So the first question that you have to come back to is, what is it that warrants a change in strategy? That's the first thing. If you have a scenario, for example, where, let's say, mortality rate is getting out of hand, if you have a scenario where, let's say, your hospitals are getting overwhelmed, if you have a scenario well, the data has been shared with us by the Ghana Health Service does not suggest so. I think the last time Dr. Patrick Umabwaji spent time to do a presentation of the availability of beds in various facilities and what percentage of those beds have been occupied. And I think it was quite clear that the narrative that generally all the facilities are full is not supported by the data.
Some have said that is on paper. On the ground, some have said that is not the case.
No, that is
you check with the frontline health workers.
No, that is in the hospitals. I'd like you to, for example, go to the Pentecost Center and find out how many beds do they have, how many of them have been occupied. And you will not come back and say that it is some frontline health worker who has said it. The data there will not support that narrative generally.
How about the infections of frontline workers?
Well, but again, for example...
These are the issues that ask that is there a need for a change in strategy?
No, for example, take the complaints by frontline health workers that a certain percentage of frontline health workers have been infected.
Over 700?
No, as a percentage of total frontline health workers. compare that to the general population. If you're having a positivity rate in the general population of about 7%, check, for example, what the positivity rate among journalists, among lawyers, among frontline health workers is, and make a determination whether actually it is true that about 30% of healthline workers have been infected. Even one infection is something that we don't want.
Yeah.
But actually do the numbers, and then let us come to a certain...
But my main question is there a plan B? Is there a plan B?
I'll deal with that one. I mean, I want to finish with the first submission, because it's easy to say 300 health workers have been infected. It's something we don't want. But as a percentage of total health workers, compare that positivity rate to the entire population and see whether it is odd or it is not odd. Because you will realize, from the brief that I have, you will realize that if you have a 7% positivity rate in the general population, and you have a 7% positivity rate among health workers, among lawyers, among doctors, among other people, it is not as though in particular health workers have gone out of hand. We have a challenge there, particularly with the availability of PPEs down. And give me a moment to deal with it. Why do we have a challenge with PPEs being distributed down? If you check the numbers of PPEs that have been produced and imported and sent to the various districts, there ought not to be a shortage there. But we continue to have reports of shortages in sometimes a particular medical facility. Sometimes you go to that health facility. Within the health facility, there are departments that have it, departments don't have it. What we've now had to do is to put in place what we call a logistics management committee at the lowest level, at the district level, which will now have representatives of the Ghana Medical Association, of GOSPA, of nurses and midwives, so that they all see the numbers that have come to the district. So that if the lower level distribution at the district is what is not working, then it is not something that we escalate to say that government is not providing PPEs. But we do know that this stores is perhaps where it's holding up, or here is where they have clogs or challenges and are able to deal with it at that point in time. So now back to your bigger question of, do we have a plan B? You go to a plan B when you have reason to believe that your plan A is not working. As it stands now, the challenge we have in our 5-part plan A is community spread. Even for community spread, when they present what they call the 7-day moving average, which I think on Tuesday they will do, you will notice that the numbers are coming down. As in the 7-day moving average numbers. That is different from the new cases that you see announced on a particular day. And the reason why they have taken time to do this analysis is because, yes, we have had challenges in the labs. We have been frontal enough to say we've had challenges with the labs because the reagents and some of the kits ran out at a time when the orders had not come in.
Have they arrived now? Because we're told we're supposed to receive it last weekend.
I think if you followed our press briefing on Thursday, Professor Ampofo from Noguchi even showed photos and videos of some of them beginning to arrive. So they are picking up those numbers so that they can do...
all the centers now testing?
Say again?
Are all the tests at centers
they
now
are not
testing?
fully there. The expectation is that I think by the first part of this week, when they are fully ramped up, we should be able to get back to our level of about 10,000 tests per day across all our centers. Currently, they came down to somewhere about, I think, 3,000 to 4,000. That was quite low because they ran out of reagents in their bid to catch up with the numbers and to ensure that our testing regime is still robust. As a result of that, if you read the fine print of the Ghana Health Service data set, you realize that sometimes when they put out data today that we have 400 new cases, they will say that the samples were taken for the last 7 or 8 days. And so you see a backlog beginning to come up again, which is what is accounting for that. But the way they cure that is that they spread the numbers over the days on which the samples were taken and run what they call the 7-day moving average. And if you look at the 7-day moving average, that number is beginning to come down. However, we are not pleased with the community spread that we have, but community spread can be resolved if we have a significant proportion of the community supporting the effort. And that is where we have to channel all our effort. I had one senior person say, instead of spending all our time trying to point blame, blaming fingers at somebody, we should channel a lot more energy trying to engage ourselves on how does everybody live up to a particular responsibility. And I think if we go there more, we'll get that 1 out of 5 pillars, we'll get that 1 under control.
Okay, at this point, let's bring in our viewers and listeners as well. I have a tall list of questions out. At every point in time, I'll try and bring them in. But let's go into the first batch of questions for tonight.
Even the Honorable Kojo Oponkroma, will you regret closing down the schools as far back as March, when our COVID case count was only 5? And now the students have returned to schools. And it's like the disease is spreading. as if the student went home and then got infected and then now spreading it in schools. So will you say that move has backfired?
My name is Jem Albert from Akrofo. My concern is about our dear brothers and sisters.
So those are our first part of video questions. We're going into the reopening of schools, especially the senior high schools, the final year and then the second year Gold Track senior high schools reopening. There are a number of issues surrounding it. So the first three questions: reopening of schools, you think is backfired, plans for infected students, and then how they will write the exams, those who will be infected. Two questions on that. And why is it that when a school records a case, we still keep it open?
Okay, so kindly oblige me some latitude to give some background as we go into this matter. You would notice that some of our persons who've sent us questions keep saying that they are recording cases in schools. They are recording cases in schools. I'd like us to agree on a number. How many cases have been recorded in schools?
How many?
We'll come to that one. But I think it is important not to do a general narrative, but to be specific. How many cases? And we'll compare that to the number of persons. All the questions that are coming show me clear that people are concerned. Parents, brothers, sisters, people are concerned about the safety of our young ones in school, as well as teaching and non-teaching staff in school. And I think that's something we should commend. But look at the total number of people who have gone back to school. About 200,000 people have gone to 234 tertiary institutions. Another about 800,000 people are now back in 1,167 second cycle institutions. And then for basic schools, about 750,000 people have gone in there. That's staff and students. That is a total of about 1.7 million people who have gone back to school. This is the sheer size of the operation that is being run for the next about 8 weeks when all of these cohorts are in school trying to finish their examination. It is a choice between two extremes. Either all of these 1.7 people stay at home, or if you can find a calculated way of containing the risk, then at least they can go back and finish their exams and leave. So what has happened so far? Take face masks, for example. We have delivered about 3.6 million pieces of reusable face masks to these persons who are in school. 3.6 million of them. Take hand sanitizers. The units that have been delivered go across about 1.7 million of them. It's taken a number of weeks, an extensive exercise across the country, over 18,000 institutions across the country.
You said you were giving 3 each. Have they received them?
My understanding is that they have. If there are any challenges, we'll be happy to know so that we can deal with them. Take thermometer guns, almost 50,000 of them, so that we can continue with the screening exercise from Buipe through Hamile to Axim, and ensure that for every single school, while they have the sanitizers, they have the masks, they have the Veronica buckets, almost 70,000 of those Veronica buckets, almost 130,000 units of liquid soap, another 130,000 units of tissue paper to ensure that hygiene and protection on campuses takes place. Apart from that, and because of the regular screening, they are in a position to determine if there's a suspected case. And I've put in place an elaborate process for ensuring that if there's a suspected case, this is how we deal with it. The challenge that has come up is that in some instances, there have been suspected cases or reports of suspected cases or reports of cases that have been communicated in a way to parents and students that has heightened anxiety, when in many of those cases, it turns out to be untrue. And I want to share with you, this is the executive brief I have on the situation in the schools. Recall the president instructed last week that a subcommittee be set up of about 6 persons to engage the specifics. I'll give you, for example, Accra Girls Senior High School. We had a big, scary conversation about Accra Girls Senior High School. The news was broken in such a way that you had parents rush to the gate in a way that some of the parents were even putting themselves at risk. You had students who even didn't know the specific numbers and how it was being contained, who then gathered and were putting themselves at risk. And that's why we say in all of these things, let's spread calm and not fear. Because when we spread calm and we engage on the issues one by one, we will see the clarity.
If this had been communicated to the parents of these children, I'm not sure that kind of fear.
We will come to the remedies for those. We'll come to the remedies. At Accra Girls, for example, a teacher and a spouse, together with 6 students, have tested positive. As at, I think, the 6th of July. testing of all the contacts of the confirmed cases are ongoing. Now you'll notice that, like it's happening in the institutions that have been shut down, when there's an index case and they test, they isolate and treat, and then they do the mass testing of everybody else in that institution, should it be found that there is significant community spread there, all of those persons will be isolated for treatment, and then that establishment will now be maybe suspended or closed down. That is what has happened, for example, at BOST. You know the statement at BOST says, we tested everybody and got this number. And we are therefore of the view that because of these numbers that we have, it wasn't because one person had tested positive there. Because of these numbers that we have, we think that it is important to shut down now and treat these persons, and then we can reopen. Even the factory somewhere in Tema, that recorded about 500. Because of the significance of those numbers, you shut down temporarily, you treat everybody. Once they are cleared, people can go about their normal lives. If you've had 1 or 2 cases and everybody else is observing the preventive etiquette, you don't have that much of a challenge. So, for example, in Accra Girls, the affected staff and students, this brief tells me, have been sent to Ghanai's Municipal Hospital in Accra and are responding to treatment. Then the Ghana Health Service is working closely with the Ghana Education Service to implement the necessary control measures. A team of about 200 personnel from both institutions have been sent across the school to ensure that testing is done generally there and the necessary preventions are also kept there. Because if you just out of panic say, okay, everybody should go home, you may actually have a positive case that then goes home to now exacerbate the situation there. But if we calm down and everybody gets a test on that particular campus, and we find out that actually, because there have been several contacts, sometimes spouses who did not contract it when one spouse had it, we then find out that the numbers there actually are not as is being spoken about. Take KNUST Senior High School. There's been one death. That death has not been confirmed to be a COVID death. The head teacher and I think some other persons have been asked to step aside while an investigation goes on there. Take Prioso Senior High School. 9 suspected cases, okay, have been quarantined on the school premises because, and there are protocols for who you quarantine. You quarantine asymptomatic persons. If you have people who are showing symptoms, they are moved to health facilities. So these 9, for example, at Prioso Senior High School have been quarantined. I think their test results are supposed to come in and then they'll have clarity.
Okay, which
so
other school?
If you take...
Which other school?
Well,
we've moved from Accra Girls.
Those are the ones that I have.
KNUST in Price. So these are the 3.
These are the ones I have as a brief here. So if
we are told about Archbishop Porter Girls.
I don't have a brief on Archbishop Porter Girls that confirms any number.
And Wesley High School.
I don't have any brief that confirms any number.
So from the brief you have, it's only 3 senior high schools.
This is the brief in front of me, and that's why I'm making the point that if we take our time and we don't whip up a lot of anxiety, because people are generally anxious. I'm a parent. But
at the briefing, for instance, last week, we had the minister mention Wesley High School and then Konongo also.
In fact, earlier he had mentioned Infantsipim and then corrected that it was Infantsiman who was reported here. The brief I have here doesn't list any of those. But here's what I'm saying. Even if this brief is not exhaustive, if we get into the specifics, out of about 1.7 million people who have gone back into the schools, you'll find that if the general population has a 7% positivity rate, the general population, you'll find that with this 1.7 million people who have gone, because of the systems and the elaborate protocols that have been put in place, even if you have found, is it 6 plus 2 here, plus another 9 suspected, not even confirmed here, it is something that can be contained. And that is why the authorities have not been quick to say, close everything down and let everybody go home. But like what has happened in, let's say, Education Ministry, where the minister himself says that by the time they finish the test, about 90% of the people had tested positive. They have grounds then to say that they are proceeding to shut down the place because they've got significant spread there. If you take BOST, for example, similar. We're hearing of other institutions that have shut down. I mean, Cocoa Board, for example, said they tested, and this is what they found. So it is too simplistic an argument to say, why have some agencies shut down and schools are open? It is the numbers that are directing the decisions that must be made. If they've tested and they find one person who is positive, and they isolate and treat that person, and they do the mass testing of the other persons on campus and those persons are negative, why must that institution
So is it to say that we are waiting for the figures to swell?
No, it's not that we are waiting for the figures to spread. They are continuing with the surveillance exercise. And the surveillance exercise is what determines what they will do. If they do a mass testing on, for example, Accra Girls Campus, and apart from these 6 beautiful young ladies who we are told are responding to treatment, nobody else has contracted it, would we say that the next 6 or 7 weeks that they have to complete their exams, they should shut the school down. I think that we should calm down, look at the numbers and the data. It's a very anxious moment for parents. Like I said, I'm a parent. It's a very anxious moment for all of us.
You have a child in senior high school?
I don't have a child in senior high school. I have 2 kids in basic school. But I'm saying that it is our ability to take our time and not panic, look at the numbers that are coming in. What we need to improve is communication with parents. And so as part of the new protocols, the enhanced protocols, every school is now being asked to designate a number of teachers who will be responsible for communicating with parents so that we don't allow parents to panic unnecessarily. And we acknowledge that parents are anxious and want to be sure that their kids are safe. And therefore, it is important to improve the communication between schools and parents. And that's one of the things that the subcommittee set up by the president, acting on the instructions of His Excellency the Vice President, is putting in place to ensure that we can improve that communication.
So the question then is, what will happen if we postpone the exams like other countries have done? Because everything we do, we look at what other countries have also done and then learn from it. Yeah. We've heard about Kenya's situation, we heard about Nigeria's situation. What at all will happen if they do not write the exams this year? Is it that you recall them to go back to school just to partake in the voters registration exercise and then, ultimately to vote for you because of the free SHS that you've touted?
Let me just give you some numbers and I use this word very respectfully. I use it very respectfully. And I use it because of the persons who have been championing the argument that you just repeated. This argument that you repeated.
I'm not repeating an argument, sir, because the issue is that what at all will happen if they do not write? Because there are other ways that we can assess them.
That's not what I'm talking about.
Can we use a continuous assessment, for instance, to make them graduate?
Registration for elections because of free SHS. And I'm saying that is not your argument. That is an argument that has been championed by our colleagues on the NDC side. And as a manifest, I know that journalists will raise it as a question. And it's fair, you are only doing your job. And that's why I said I'm going to use a word.
Is that not a fair argument to make? Coming. Because parents are also, I'm sure the questions will come up. I have not even responded to it, Let me respond. I said I'm going to use a word. That word is not directed at you. I use it with the greatest of respect. And I use it for the meaning of that word. What makes nonsense out of that argument is that the people who are going to, for example, basic school are about 750,000. Are they going to vote? The basic school students, are they going to vote? We are on senior high school.
No, I'm saying.
They are the ones registering.
I'm saying.
So that's what we're talking about.
No. The argument that has been made is that schools are being reopened so that people can go and register.
We have not recorded cases in JHS just yet, respectfully.
I'm coming. I'm dealing with the argument. The argument, that's why I said give me some latitude. The argument being made is that schools are being reopened for people to go and register and vote. And I'm saying that those in basic school, the JSS students, are they going to register and vote?
But that's why I specifically asked about senior high school, Mr. Okonkwo. But let's respond to that and then we can move on.
I'm coming to that. I'm saying that what makes nonsense out of that argument is the fact that if you look at basic schools, they are not going to register to vote. The argument has been that you want these final year students to go and complete the examination and go out. Those at senior high school, again, complete and go out. Form 2 gold track who hadn't finished for them to complete. Tertiary. Those who are going are those who are going to complete their exams and go. Indeed, tertiary institutions that have completed their exams have said clearly that they will not even open up because they have completed their exams. If you put all of this together, that argument of reopening for registration and voting is thrown out of the window. In any case, what the Electoral Commission is doing, which we are all watching and have had opportunity even last week to speak about, is supposed to be done under an environment that doesn't put anybody at risk. That is why, for example, I don't know if you have any report that says that in the 2 days I think that they registered those who are about 18, any of the COVID-19 protocols were breached, maybe social distancing, wearing of masks, they were not doing. I haven't seen any of those reports. But we should all ask the Electoral Commission to ensure that they do their work with strict accord to the protocols and the standards that have been put up, and banish some of these, may I say, arguments that some persons throw in just to muddy sometimes the very beautiful conversation that we are having. We're having an opportunity where kids are going to school to go and finish their exams and get out of school. If there is need at any point because of some escalating situation to attend to it, it is something that will be attended to. But let us not rile up some of these unfounded arguments just for the sake of arguments. For example, the question of supplementary exams, that if a child is sick and is not able to participate in the examination, what are the arrangements? I've been speaking to some heads of schools who have called me personally to ask, about what happens. And the holding answer I've given them is that whenever we were in school and it was time for examinations and one of our colleagues was ill and in hospital and could not write those exams, some measures were put in place to allow those persons sometimes to even write in hospital.
Okay.
Ought that to be different in this scenario? I don't think so. But on Tuesday, we're going to get the Ghana Education Service to speak frontally to that. But there have been protocols in this country, I think, ab initio, for persons who are sick and in hospital during examination period. It is my expectation that those same protocols would apply, particularly for those who are symptomatic and therefore are in hospitals. But if we look at the numbers that we are seeing, out of the about 1.7 million persons who have been asked to go back, if what we are seeing from Accra Girls and a number of these institutions is anything to go by, then I think we should move from the big narrative that there's infection in schools and get a bit more specific. And it will also help to calm the anxieties of some of the parents.
So there was also a question in there. The second question was asking that what happens if they finish the exams and they're going back home? Will they be tested? What will happen?
We have said over and over again that testing in itself is not a panacea.
Okay.
When you tested here at Multimedia and some persons tested negative, it does not mean that all of those who tested negative initially can never test positive subsequently. So testing is not a panacea. What is a panacea is the observation of the preventive etiquette that we are required to do, whether we are positive or negative or have been positive before, whatever the case may be. And that is why I think even one of your video callers from the UK said that even in their case, they didn't test everybody before going to school. Because the global ecosystem understands that testing is not a panacea. It is when they recorded a case in the school that in their case, he says they will shut down the school. We think that that is not necessarily advisable, because when you do that without necessarily testing and those kids go back home, if you have a positive case, that positive case goes back home and then you now exacerbate community spread. The view from the public health experts is to contain it, do a mass testing of everybody within that environment, and if you have a significant situation to deal with, you act on it accordingly. It's not to panic and say shut it down and let everybody go home at this point. The institutions that have been shut down, they have been frontal to say when we tested, which means that they had an index case and they proceeded to do the mass testing, and the numbers they got dictated something. Even the case of some of the schools that you are seeing, they've had about, let's say, 6 cases, and by the time they are done with the mass testing, they don't have a significant case. I'm not sure we will repeat the same argument. So let the persons who are dealing with the tests and the data do their work. Let's all calm down, let them do their work, and let that data inform the decisions that are made. Okay,
so we'll go into the next batch of questions, but before then, the Western Regional Health Director, because you don't have all the schools in there, maybe it's yet to reflect in that executive brief, but we'll hear from him shortly on the number of schools that have recorded cases in the Western region. That we'll get into the next batch of questions.
Only Archbishop Porter Girls. They have only one case. There were actually 19 suspected cases, and then when we send the samples to the lab, only 1 turn out to be positive. The rest are all actually negative. And social distancing is okay in the school. Everything is going on well. But we have other schools. We have about 7 schools that are got confirmed cases. In the East Axim is one of those schools of 14 suspected cases that we took Wednesday to Accra, and 8 of them were positive. 5 are still pending. And you have Shama has one suspected case that was negative. St. John's Secondary School, 1 case positive. And Adiembra, 8 suspected cases, 2 turn out positive, 6 were negative. And then the Hunterman girls, 6 suspected and 2 positive. The rest negative. So these are the schools that we have in the region actually positive.
Now, so that's the situation in the Western region. We got that confirmation just this weekend by Dr. Jacob Mahama. That has not been brought to your attention.
This brief I have is as at, I think, Thursday night when they had this meeting. I have mentioned already that this brief may not be exhaustive. You are telling me that this is over the weekend. So obviously, if this does come in by Monday morning or Tuesday in terms of the updates, the numbers will change. But watch this. Porters, he says 19 suspected cases. They did not have a loose system. Screening system, testing system, picked out 1. I'm very sure that that one, in accordance with the protocols, if it's somebody who is symptomatic, will be moved to a treatment center untreated. If that person is asymptomatic, the necessary protocols will be followed. But again, take the population of Archbishop Porter girls. If they have found one case there and have been able to quickly identify it and contain it, is the suggestion that the entire school should be closed down. And that is what I'm saying, that those who deal with the data tell you clearly. Okay. And what is important is to have a robust mechanism that is able to do the surveillance, find suspected cases, confirm any of them that may be positive, and quickly contain it so that the others can go about their normal lives. However, we acknowledge that it's an anxious moment for parents. What we need to do to solve that anxiety is to make more information available. And that is why we have asked that on every campus, 2 teachers now be dedicated to engagement with parents so that parents can understand that, dear mom, dear dad, don't be anxious. We had a number of suspected cases because of our robust screening system here. And we proceeded to test and found one. That one has been contained. Once we found one, we are going to do a more general mass testing of everybody. And once we do that testing and we find out that there are no other cases, we don't have a problem. Okay. If we find any others, we isolate them and treat them. And so panic must now be toned down. So
per the strategy that we have, I know that during the President's interaction with Vice Chancellor Ghana, for instance, he said that the outcome of schools reopening will inspire confidence. I don't know how he feels about what he's hearing so far, but you say that it's under control. But at what point, per the strategy that we have, at what point would we say that the situation is really out of control, that the students must go back home?
So let me use the 2 institutions that we've had some numbers to play with. Take Porter's girls, as has been explained to us. If you have one, I don't have the breakdown of how many students have gone back to Porter's. If you have 1 out of, let's say, 100, I'm sure that everybody would agree with us that the strategy that the public health experts have put in place, which is to A, isolate that one and ensure that that person gets support, B, test the other 99 and be sure. Don't just say everybody should go home. Contain and test everybody and be sure. If you find any others, you treat them. If you don't, then they are fine and can go about their work. Everybody will agree that if you put that on one side and you put on another side a scenario where you test these 100 kids and you find 60 of them, 50 of them, maybe even 40 of them positive, you cannot continue with the status quo. So it is in examining what goes on, putting in place systems that allows you to do the surveillance, to do the testing, and to take decisions based on the testing, that you will be able to make informed decisions. One of the things that we've realized with COVID-19 the world over, if you engage with governments, and maybe you should speak to some of the other governments, is that a quick panic in an attempt to shut down everything without more is in itself not a solution.
Okay.
You need to do a lot of surveillance, a lot of gathering of data to know for a fact what you are dealing with, and then take decisions that are informed by that data or that science. So, for example, if in Accra girls, 6 test positive, and you decide to contain that 6, test everybody else, and proceed from there, it will be very different from if by the time they tested, 40 or 50% of the students were positive. The decision you will take based on that will obviously be different. That is why in the institutions that have shut down, when you read their statements, they start off by saying that they did the mass testing and they found this. And based on that they found, that is why they are taking this measure. What it tells you is that they had an index case, which then led them to do a mass test. And then from that mass test, you take a decision from there. Take multimedia, for example. In your statement, you said you had about 5 cases here. You didn't close down multimedia. You didn't close down multimedia. Why didn't you close down multimedia? Because those 5 persons who are tested positive, at least those 5 that you told us are tested positive, you managed to contain them, ask them to stay home. There were some of them who went to the hospital. My good friend Gary spoke about it openly. I keep applauding him for that openness. But you didn't close down multimedia because you were able to contain it. If it was a scenario where by the time you tested...
Children here, and the issue about the ability to...
The value of life.
Of course.
The value of life is not about children or young people. I'm saying that if by the time you tested, you had 40, 50% of your staff, I am very sure that Mr. Kwesi Chum and the team here would have taken a different decision. So just like how you are led by the data to take a decision, that's how the country must also behave.
Well, a number of government officials have tested, and government has not come to a standstill. Let's get into the next batch of questions at this point, Facebook and WhatsApp questions that you've also sent in.
I'm told, by the way, 60 persons were tested at Archbishop Porter's, and one is what came out as positive.
All right. Thank you.
Even though they had about 19 suspected cases, they proceeded to test.
Okay. So let's get into the next batch of questions. So these are Facebook questions. This one says, the director of Ghana Health Service, Patrick Abuaji, wrote a letter stating that Carlos Ahenkra has recovered after 2 negative tests. I thought Ghana said it had revised its policy and that only 1 test will be done. So what changed? It's clear that we are in the animal farm. Honorable Kojo Ponkroma, please address this issue. I have another one that says, have we all come to the realization that even with a pandemic, our decisions are politically motivated? With what we have done before and now, can you say our decisions have been based on science, logic, or obviously what government wants? Thank you. Now this one says, please, may I know if the government has thought of another lockdown amidst this pandemic? And Echo says, please ask Kojo what at all will happen if they cancel all exams this year and bring the kids back home. Still on Facebook, Bedema says, please, we need updates on the 88 district hospitals and regional hospitals. What stage are those projects? And was it just a campaign message? Okay, so Echo's question, we've taken that already. Do we have any more questions? Okay. So we saw a letter from the Ghana Health Service, and the questioner is asking about it, that Carlos is taking a second test and a second negative test. We thought we had revised our testing. It's supposed to be 1 test, and then you can
or in
one
some
negative.
cases no test at all because of the clinical recovery
So
policy.
what happened in Carlos's case, and such that we had a statement from the Ghana Health Service? Is that the norm?
I'll speak to that shortly. I'm still getting more updates on Archbishop Porter's. 1,250 students returned to school. The screening exercise flagged about 19 of them, and they proceeded to test beyond the 19 that were flagged. Persons who were close to the 19 added up to about 60. So they proceeded to test about 60, and 1 is what came out as positive, which they have isolated, and then they are proceeding to ensure that there will be treatment for this 1 person. And then they'll proceed now to look at the general population. If by the time they test the general population, there's nothing untoward there, I'm not sure the anxieties of parents will be at that same level.
So what measures have they taken? Well, because parents are watching.
Well, the brief I'm getting is that they will now proceed to test the entirety of the students, and then based on that, they can make a decision. Now, if, like I'm saying, by the time they test all of that, if it's indeed this just 1 student who possibly had even contracted it at home and came to school before it started manifesting in terms of symptoms, once that is contained, another person's all test negative.
Has their parents been communicated to?
I do not have that brief currently, but as I get some more briefs, that is what I'm able to share with you. But I'm doing this to make the point that instead of saying that there's an outbreak in the school, it's good for us to get into the specifics so that the anxieties of parents are also allayed. And I'd like to call on my colleagues in the media that while we do our good job of reporting, we've done a fantastic job so far, let's get into the specifics so that parents also know what they are dealing with and don't get unduly anxious. Now let's talk about this letter from the Ghana Health Service. The Ghana Health Service, and this is what my checks reveal, the Ghana Health Service, when we started bringing in persons in the assisted travel, developed a standard letter template for communicating the 2 negative tests to these persons. So it's a standard template that the district health directors who do the engagement with the specific suspected cases have. And right from then, and even right from the time when we're having the double negative policy, when you test double negative, then they issue you with such a letter. Now that policy has been revised. And now the policy has been explained based on A, WHO standards, and B, our own test here in Ghana, allow us to do the discharge after a certain number of days for clinical recovery. So the 2 negative tests are no longer a requirement. Does it mean that you, MFA, if you tested positive today and you finished with your treatment and you opted to test again to assure yourself, you will be denied? No. you will be allowed to test. There are private centers that can even test. You'll be allowed to test. You can do your own, on your own volition, you can do your own double negative test.
Will I get a statement from the Ghana Health Service?
You may not get a statement from the Ghana Health Service unless you request. So this, in my understanding, is a politician who's had challenges because he had his own issues with it and has subsequently done on his own, has done his double negative test and seeks to get a document to the effect that indeed he has done so that he can go about his normal business and engage with other persons.
So was this released from the Ghana Health Service or from Mr. Ahinkra?
No, it is from his district health directorate. That is my understanding, that it's coming from his district health directorate using the same template that the Ghana Health Service has been using. So it's not like the Ghana Health Service has changed its policy again or has done something special for somebody. I'm sure that if you perish the thought, tested positive, and subsequently you had recovered and you wanted to come back to your employers here at Multimedia and you said you wanted to do 2 more tests, both of which came out negative, and you asked your district health director in charge to give you one of those letters essentially to make that point, and the person proceeded to do same for you, it will not be untold.
Is this not a PR gimmick just for damage control purposes?
Well, he would have to answer that. I don't speak for him. I am explaining the situation that comes up because there's then the question that has the Ghana Health Service changed its policy? I'm explaining what we have discovered as we went into that one. But the other questions you would have to address them to Mr. Ahinkra.
So there was a second question about the science, logic, or whether it's what government wants so far, what you've done.
Yeah, I think I've been at pains this evening to even explain why you don't just panic into a closure of schools, why institutions close down, what the numbers mean, and even in the case of Porters going deeper. And I think it's quite clear that all of these decisions that are being made must be supported by something. They are not yanked out of there. They must be supported by something. You may be anxious. There's nothing wrong with being anxious. You may be worried. There's nothing wrong with being worried. But what we all need to do is to proceed on the point of understanding the approach. And then after understanding, even if you want to disagree or you want to give feedback, etc. But we ought not to start off by saying, no, it's not based on anything. It's just based on what government says. I mean, I'm not sure that's actually going to help us.
So while sorting, for instance, I saw a question about whether the independent scientists in this country are even involved in some of the decisions that you make. It was one of the questions that I saw during the sorting as well.
Every one of the task force meetings that I have been to, chaired by the president, supported by the vice president, we have epidemiologists, infectious disease experts, public health experts, population people, security people who are all there from their various backgrounds, sometimes in their own uniforms, offering their own views and guiding the decisions that are made by His Excellency, the President. Okay. You must understand that when it comes to professionals, even go to the Supreme Court, sometimes you can have dissenting views. You can have sometimes 5 judges go left, 4 go right. When it comes to professionals, there are times when even some of the professionals will disagree on a particular line of action. But, leadership, and maybe someday we'll have an opportunity to talk about leadership in times of crisis. Leadership in times of crisis is not a very simple one-button pressed matter. You would have to listen and engage various stakeholders and in the end make a judgment call. If you follow the literature, for example, on the Americans going after Osama bin Laden, if you read the literature, different security experts from the CIA, from counterintelligence, from whoever, gave different views and measures. And in the end, the president in the chair has to make a judgment call. If he gets it right, it goes to the credit of the entire country. If he gets it wrong, the entire country suffers. But that is the value of leadership. It's not about being panicky or apprehensive. In this instance, all of these persons are at the table. They proffer advice. The president listens to all of these, and in the end, he has to make a judgment call. And I think from the beginning till now, the 5 main pillars that he has rolled out and what they are intended to achieve, we can all see the results. As I have sat before you this evening, I have told you that where we have a challenge today is item number 2. To ace that challenge requires the entire community to rally around and support the exercise. So let me give you an example. If, for example, we say we are easing restrictions in schools, kids should go back to school to write their exams. You have been given 3 masks, sanitizer, etc., etc. A teacher has been given sanitizer, etc., etc., masks, etc. And you choose to put your mask in your pocket. You are defeating or undermining the exercise that we are on. And that is where I think we need to push a lot more attention. I'm going to put you on the spot here. You are my sister, so don't worry about it. So look at the face shield you are wearing. The science is that it is improper to wear the face shield without a mask. But increasingly we are having television stations, for example, all guests on television stations wearing face masks, a good number of them, face shields, a good number of them without the face mask underneath.
I'm wearing the shield because you're wearing a mask, and I don't take it out there.
Well, but the science is that you've got to wear the shield and the mask, no matter the circumstance. But here's my point. We now need to do a lot more education to get that little part of community activity that is not in confluence with ours to come on board. And the view is that if we spend a lot of energy, instead of pointing fingers, if we spend a lot of energy doing a lot more of this education, and we've done fantastic so far, the media, government, other agencies have worked together, it's been good. But we have a challenge on point number 2 out of 5, which is communal participation. A good number of people are doing it, a terrible number of people are not doing it. And we need to encourage the general public that, listen, government is doing all that has to be done for you. We are now at the point where you have to stop making excuses and justifications. I can't breathe it well, I can't do this, I can't do this. And participate fully so that we can cut into that last mile activity that we have. And I'm sure that as we work together, we can achieve that.
Most people say that we're doing just fine, largely until the NPP parliamentary primaries, for instance, when we saw what we saw. There have been a lot of explanations that have been given, but it's also one of the reasons that we ought to also look at and condemn. But there are other questions, so let's go into it.
Another lockdown?
Yes, another lockdown.
I'm happy you raised that question. I mean, I'm happy your colleague raised it.
Scientists have also said there should be some localized lockdowns.
Yeah, it comes up over and over again, and we have had opportunity to address it several times at our press briefings. With the opportunity you give me, I will reiterate it. All cards are on the table. That's the expression I always use, right from the beginning. All cards are on the table. We continue to A, observe compliance, and B, observe the results of the surveillance and the testing and the compliance. So, for example, if you are doing surveillance and testing in schools, depending on what the situation requires, and it becomes necessary that you will close down a school, I don't see President Akufo-Addo saying that this is what the numbers say in a school, but he will refuse to close down the school. I don't see him doing that. He has said already in one of his updates, I think you and I were here when he did that update, and we had opportunity to have a conversation after that, that should it become necessary that in particular districts there's such significant widespread that we have a lockdown plus curfew, he will not hesitate to do it. So all cards remain on the table. Today, the data shows that some of the highest numbers that have come, sometimes as a result of a backlog even, some of the highest numbers sometimes are spikes in workplaces. We see the data from, let's say, this organization or that organization. So you recall about 2 or 3 weeks ago, the Honorable Alan Kwadwo Kyerematen came to present an update on compliance in workplaces, because we were beginning to observe that workplaces were experiencing some high numbers. We need to do some more education and encouragement for people to observe the etiquette within these workplaces. But should it become necessary, based on those numbers, the president won't hesitate to take that decision.
Okay. Now, 88 district hospitals, let's add the 6 regional hospitals also. What's the status, or it was just a government campaign message?
The president was quite clear. He has tasked the committee to do some work on it. When they are done with their work, he expects them to come to cabinet for approval and then do a national announcement of how it's going to be done.
What's the status?
I'm sure you quite recall all that. They are not before cabinet yet. My expectation is that they would have by now gone through the infrastructure subcommittee of cabinet, so that the next cabinet meeting, I think next Thursday or so, if my gauging is right, they should be able to, if they didn't face any difficulties at the subcommittee, they should be able to come to cabinet, and once that hurdle is crossed, then they can tell the country where they are on that project.
Cabinet is sitting via Zoom or physically?
Well, we haven't sat yet. It's a next week meeting. I don't know whether it will be, by technology or it will be in person. Today's meeting with the president was by technology. Sometimes it's a conference call, sometimes it's via the technology platforms. I can't tell what Thursday's cabinet.
Okay, so the final question in this batch was, what will happen at all if they do not write exams this year?
It's a hypothetical, and I'm not going into that. I'm dealing with the data that we have now, which is that the decision has been made that they will write the exams, and the surveillance and the testing is taking place on campus.
What will happen if it does not happen?
Like I said, it's a hypothetical that I'm not going into.
Okay, let's take the next batch of questions at this point. Are they ready? Facebook or WhatsApp? We'll still stay on Facebook. Nanazu, we need to recall students and close the schools. Government and private offices where they had infections have closed. Indeed, the president is in isolation because of a suspected case in his office. Why not the schools? Nigeria, US, UK, Canada, South Africa, and many others have now either stopped reopening of schools or scaled back the time. What is holding us back? Perhaps government sees it as a defeat, but it's better to delay a grade than sacrifice a life. Hashtag close the schools now. Nanazu sends that one. We've been speaking about that. The next one is still on Facebook. Nemo Isaac says the security personnel, especially some of the police, are not helping issues at all. They stand at the road where market women are parked in the motor Kia in their tents without face masks, but they would stop them and take 2 Ghana cedis from them and allow them to go. What is the government doing about these law enforcers? Circumstance the proof says, if I ask Mr. Oponkrima why parents are not allowed to visit the SHS students in school, but their national youth organizer is moving from one school to the other to campaign. Now to WhatsApp, Katechi Akwesi Centura Swasi in Kumasi says, should Ghana adopt a different way to fight this pandemic as the standing protocols are not adhered to strictly and there is unfair application on its sanctions? However, what is the state of the test kits developed by KNUST as we are faced with serious challenge of testing capacity? Still on WhatsApp, the next one is from Edem in North Kaneshi with the hashtag Beyond the Lockdown. Please query the information minister for me. It seems the presidency knows how to write breathtaking speeches, but the delivery is the issue at the end. Prior to the opening of schools for SHS final year students. So Edem, Mr. Oponkrima is asking what you're hearing. What some people have also said is that even though we said we're providing 3 reusable face masks, that is not the case. Some students are not receiving. They're saying others are saying that I cannot independently verify. But that's what Edem is saying. That what we're hearing.
You know, I've been in this business for over a decade, and one of the lessons I learned in journalism over the years is that you can easily get swung if you don't ask for the specifics. And that's why I always keep saying...
Unfortunately, Edem is not on for me to ask.
I understand totally. No. It's not about you. I'm talking about the fact that that's why I was asking, what are you hearing? Because it's easy to say, but what are we hearing? And then it's gone. And an impression is created, but there are no specifics for you to engage with. If you tell me that in school X, this has not been done, I can even go into our system and say, I want the Logistics Management Committee to check for me school X. That is how come, for example, in one of the big hospitals in Accra, when we were hearing that there were no PPEs, and we asked for the specific and were given the specific, and we went in, we realized that there were PPEs in store. It had been given to ICU, but had not been given to accident. The accident and emergency center had not received them. Meanwhile, somebody can ride in on an ambulance and be an infected person. So you can
say here and now that all schools have been provided the 3 reusable face masks and the sanitizers that were provided.
The brief I have here is that this is the distribution that has been done. If there's anybody out there who hasn't received same and wants to draw attention to it.
So the brief says all the schools have received.
The brief I have are the numbers I have given you. If there's anybody out there who is of the view that a particular school has not received, do well to let us know and we can follow up and find out. Would you know that, for example, when it came to PPEs, there were instances where we're finding that after it had been distributed down to a district, some persons who are Ghanaian citizens in the midst of a pandemic like this, who are supposed to be public officials, well-minded, were pilfering PPEs for other purposes. But it is when you give the specific that we can track through and find out that, Joe, we gave you 4,000 units. You have only distributed 3,000. Where is the other 1,000? And then we can get into it. So sweeping statements without specifics, with the greatest of respect, makes it difficult for us to engage. And that's why sometimes we ask for those specifics. If there are law enforcement officers who are letting us down, like one person is suggesting, it will be very unfortunate when in the midst of a battle and part of our infrastructure is our law enforcement officers. And you expect that good reason will prevail. That if they are supposed to help us with enforcement, they will do so. We've seen examples of law enforcement officers doing a brilliant job educating the public. You saw the video of the policeman educating some persons. Then we see some other persons, I think just last night or so, another law enforcement officer literally assaulting a woman in a queue, I think at the registration center. I can't get the sound properly, but it appears it's got to be over whether it's wearing of masks or something. There are some who let us down, and we have to consistently make that point that they need to be up to the occasion. The president always makes the point that we are not in ordinary times. It cannot be business as usual. They need to rise to the occasion. But if there's somebody who has specifics that has to draw attention to it, we can deal with it. Take the KNUST test kits, for example. So we have explained that what the KNUST did was to develop RDTs. RDTs ordinarily are for testing what we call antibodies. Antibodies are, I don't know the scientific word, but they are things that your body produces to fight the virus or to fight any other virus. So when we find antibodies in your system after testing, then we are able to conclude that you may have had it and your system has been able to fight it. Antibodies mostly are for surveillance. But if you want to get the proper diagnostic test, it's a PCR test. They have done all sorts of IDT assessments between FDA, Ghana Standards Authority. They have still today not been able to find an IDT that is near conclusive like a PCR. And that's why they are not able to say IDTs are the way to go. Because if you do that, you end up getting a lot of false negatives and false positives. And the precision that you want so that you can now make decisions on, you have difficulty in getting.
Okay, so I'll take you back to the issue about the reusable face mask and the provision at the various schools. Like you said, we need to check and be sure that which specific schools have not been able to receive. Thankfully, we have reporters across the country, and we started receiving a report from the Oti region, for instance. My colleague Peter Senu is giving us reports. I would have to check the specific schools for you right now, but a number of schools that he visited over the period are yet to receive. And then in the
Suguru, says a number of schools.
Yes, he's giving me the details. My producers will just give me the details shortly. And then in the Suguru JHS in Wali Wali.
That's the vice president's hometown.
Okay, so they are yet to receive. We are told that they are yet to receive. So I'll be giving you the numbers as it comes in.
It'll be good to get
schools.
all of these ones so that we can get into the specifics and track what may have happened in these instances.
Well, now let's go into the next batch of questions, and then as we get, whilst you're watching also, if you have wards in some schools that are yet to receive the reusable face masks, the 3 reusable face masks that was promised by government, together with the sanitizers and the other things that were supposed to be provided by government, let us know. But let's go into some more questions. We've taken this one already. This is from Circumstance in the Proof that has been taken. If we're ready with the next batch of questions, let's go into it. So Steve O from Malam says, when will travel restrictions be lifted? I mean the airport, because travel agencies are suffering. Please, Mr. President, come to our aid. We are also Ghanaians. And Alfred Morty says, you missed an opportunity to test all the students before reopening schools. Are you going to take the next opportunity to test all of them before bringing them home? Yes. So the issue about testing, Alfred, we've responded to that. Now, lifting of restrictions at the borders. It's a big issue.
It's been one of the trickiest parts of this exercise, because as we are aware, the first risk was the risk of importation. By keeping our borders closed, we are of the humble, considered opinion that even as of today, we are limiting the risk of importing cases because the borders are closed. What has happened is that we have allowed evacuation flights to get out of the Ghanaian jurisdiction because that doesn't pose a risk to us. Now, in allowing Ghanaians who want to come back home, the consideration must be to contain the risk that is associated with them. We have a limited number of facilities that can accommodate them. You recall that the Foreign Affairs Minister mentioned to us that we are not, with the greatest of respect, going for, let's say, 3-bedroom, 4-bedroom guest houses. You are looking for something that has a significant number of rooms, so that, and not just a significant number of rooms, but rooms where people have their own sanitary facilities, so that when you post health and security persons there, their numbers are also quite efficient. The effect has been that the hotels, etc., that have been available for this are also quite steep. I mean, I saw some of the prices that some of them were charging, and it is quite steep. And there are continuing engagements with them to see how some of those 14-day prices can be brought down. But the consequence is that only a limited number of persons can come in at a time and do their 14 days and get out so that another number comes in. I think so far a number of flights have brought in persons from various jurisdictions. My understanding quite recently was that the facilities were exhausted and they are waiting for exit so that they can bring some more persons in from Germany and other parts of the world, and we look forward to that one. But one of the requests that keeps coming out is about exit flights. I have a visa, I want to go to the US, I have a visa, I want to go to the UK, I have a resident permit, I want to go to Canada. Why don't you open the borders for me to go? And I think that it is one of the things that the Presidential Task Force will have an opportunity to table when we do attend upon our next meeting. But it is something of concern to us. It is just that the risk must be managed in a careful manner.
Okay, so we heard about ECOWAS border reopening at some point, July 15th or so. Is that still happening?
I don't get the indication that the Republic of Ghana is signing up to that immediately. I don't get that indication. We have been quite clear from the beginning that the world and the sub-region is all trying to learn as much as it can about COVID-19 and how to respond to it. And some of the decisions, some of the policy positions, sometimes from the WHO or from the EU, etc., may look fanciful initially, but there's always a clause at the bottom that you have to subject it to your in-country dynamics. That is why, for example, when the world said surveillance, Ghana decided to go a step higher to do the enhanced surveillance apart from the general surveillance. It means that we're going to get more cases because we are even surveilling other people apart from those who have symptoms. So we'll get some more cases. It means at some point we'll have challenges like what we've had with some of our logistics, etc. But it also means that we can find people early, give them support early, and hopefully they can get out early so that we have a higher recovery rate and a lower mortality rate. So you look at what the world is saying, but if I'll borrow the words of Dan Latte, you domesticate it. And ECOWAS has made its policy position clearly, but we will have to domesticate it and make a decision whether it works for us or it doesn't work for us. And I don't get that indication at this point in time that we are going that route.
Unfortunately, I'll have to miss my colleague Mapito again. She's not coming back on the 15th of July. We're all hoping that she would. But we missed a question on Nanabi. So parents have been asked not to visit their children in school. How is it that the youth organizer of your party has been engaging students in some schools? The question also came in. Is it that we are permitting campaigning or political activity on campuses?
It will be improper to permit any person or group of persons to go and campaign on campuses at this point in time when we are not allowing parents to go and see their wards there. That will be improper. I also must say that I have seen photos of politicians from both sides of the divide on campuses ostensibly observing what registration is going on. But specific to Nanabi, I have just seen a statement that his office has released, which seeks to give an explanation of what has transpired vis-a-vis the stories that are going around. I have not had opportunity to read it in detail. It's just popping through. I think it would be good that maybe at some point when you guys examine the statement, you can engage him on it and get a clear understanding. It's just coming through on my phone right now. But generally, it will not be proper to have any politician on campus campaigning at this point in time. I don't know if that is what has happened in that particular instance, but he has a statement out that seeks to put out the details.
So both sides are doing it. You say that you've seen both sides do it. Is it something that you're going to take an action against? Because if I'm a parent, I'm not allowed to go see my children. By a politician is allowed to do so.
It will be improper if indeed that is happening. The school authorities, I'll be surprised if they are allowing politicians to come on campus and campaign at this point in time. The school authorities ought not to allow that at this point in time and ought to take action if they find any such things going on. But I would like to encourage you to please take Nanabi's statement, examine it and engage him on it further. It's just coming through. I haven't read it, but I would encourage you to, so that his side of the story is also quite clearly put out and not what some persons have just put on social media only.
Okay, so we're getting a response from some parents and from some schools on the issues about face masks. Please watch this. This is a student using a polythene bag. This is from our correspondents. We are getting videos from our correspondents.
This is where?
This is from Sugru JHS. And
that's the one that you drew attention
exactly.
to? Okay.
Yes, this is the situation at Sugru Junior High School.
But I see another student by him wearing a mask.
Wearing a mask. So we need to find out why.
Yeah, we need to find out whether, for example, he has left his mask at home or he didn't get one at all. That's why he's using this. Because I see the next student sitting by him wearing one of the produce masks. But we have to get into it and have clarity on it.
Okay, so we'll give you more videos.
This is what?
This is Sugru JJ.
In Wali. Good.
Exactly, that's from Elias Sotanko, my colleague there. A number of videos that he's also sent me here on my phone. I'm unable to show that, but let's listen to him.
Yeah.
Because our masters has not given us nose masks, so we are begging for the president to give us nose masks before we stop using these polythene bags for nose masks.
Okay, so that's the situation. Now, Peter Senu, also in the OT region, is also sending that Basa SHS, Rara SHS, they've only received one face mask, reusable face mask, for instance. So we're getting more reports. So in Kwanta Community SHS.
So Pasa has received one instead of three. Okay, we need to follow up and find out.
Bueman also, we are told, KJB Asato SHS, only one each.
Yes, instead of three.
Instead of three.
Okay.
In Kwanta SHS also, and counting Ahamansu Islamic SHS, we are also getting that, since you asked for.
And they are all doing one instead of three.
Yes, for this one, for the OT region, the schools that I've mentioned in the OT region, we're told that they have one each instead of the three. Yes, but the Sugru, you had the child. Yes. They have not received any.
And then apart from seeing that child, I see somebody else sitting by and wearing what appears to be one of the...
What appears. I'm happy you said what appears.
So, like I've said over and over again, we have to get into these specifics and find out. Because like I've mentioned to you, in the case of doctors and nurses, you find out sometimes that you've sent it to the district, lower level distribution becomes an issue. So in this particular instance, for example, you're telling me in OT, some say they've received one instead of three. Yeah. We have to get into the details and find out. Have they left it at the district office, whatever. Then we get into those details.
Okay. So one other question before I go into the final batch, the issue about churches.
Yes.
And the 1 hour service.
Yeah.
We said that it was going to be looked at. All the restrictions I had put out was going to be reviewed. Where are we with that? Has it? What exactly is the issue? Are we still going to continue going to church 1 hour when other activities are happening more than an hour?
There are a number of churches that have, of my church, for example, the International Central Gospel Church. Reverend Dr. Mensa Otado has been quite clear that we would have to hold on for a while and observe. A number of churches are voluntarily taking the decision. Dr. Bolinya Mitchell's place, for example, I think that's Maker's House, they've taken a decision that they will hold on for a while. And then there are those that have reopened. If you take some of the Catholic churches, I think just this evening I was watching on one of the television stations, Catholic churches clearly marked on the floor where social distancing, etc., even communion is being handled in a very clear manner. I think the jury's out. We would have to, hopefully by the time we come to the end of this month of July and have an opportunity to observe, that'll be about 2 months of what has happened so far, be in a position to make a determination. And I am pretty sure that the president, as he continues to listen and observe and look at the numbers, will make the decision that will be in our best interest. Okay.
Well, let's take a look at one more child on the issue of face masks.
They have not yet given us nose masks. I want to tell the president that we don't have nose masks in our school and want nose masks to wear to prevent the spreading of the virus.
So it appears it's the same school, like you said, Sugru Junior High School. So I just wanted you to know that it's not just one child.
I'm happy to get the specifics so that we are then in a position to engage the district education director, regional education director, that these are the numbers that came to you. Where are they? Okay. Like I told you, in the case of the health professionals, sometimes you find out something very interesting there. So these specifics will help. Wale and OT region. These are the specifics that have come together. And I give you my word, by the time you get back on there next week, we'll get specific responses for these ones.
Okay. Well, do we have some more questions or we'll go live? Okay. So the issue also about contact tracers. Are they still working?
My understanding is that they are still working because there are contacts that are being traced even as we speak from positive cases. So I don't have a brief that says they are not working. My supposition is that if today contacts are still being traced, it is being done by the contact tracing teams. Is it being done at the same levels that we started off with during the lockdown in Greater Accra and Greater Kumasi? I don't think so, because that was a specific exercise to lock down and go after a certain cohort. I remember going through the numbers with you. Initially about 6,000 and then their contacts, etc. So it obviously will not be at that same level, but contact tracing is still proceeding.
Because the issue about the payment of their allowances, it came up. I don't know if that issue has been resolved.
I don't have a brief on whether it's still an outstanding issue.
Okay. Well, we'll take the final questions for this evening. We're really out of time. We'll take the final batch of questions. Then we can wrap up. Okay, so we're on Facebook. Is it Twitter or Facebook? Okay, so Yakubu Idrisu Hussein says, my question is, if they really care about the life of the citizens, why are they asking us to go out and register for voter ID cards when they know that the virus is about life and death? We all know that our constitution allows us to choose a leader to rule us, but when you are alive, you vote, and when you are not alive, you can't vote. Yakubu Idrisu Hussein's question. Okay, so that's Yakubu Idrisu Hussein's concern.
Yeah, I'm not sure Yakubu is saying that all the political leaders. I saw a video of President Mahama asking people to go out and register. Today, President Akufo-Addo in his engagement was asking us to talk to people to go out and register. EC is talking about it. Everybody's talking about it. I'm not sure that all of these people don't care about the lives of citizens. They have all said that we will go about our normal lives while observing the preventive etiquette. So yes, do what you have to do, but you have to wear the mask. You have to ensure that you are sanitizing your hands, etc. And if you do so, you should not be ordinarily in harm's way. Even though we acknowledge that some persons may do their best to observe all the etiquette and still, through some other settings, may contract it. But as much as possible, you cut down your risk when you are doing so. So I'm not sure we can say that all of these persons, from President Mahama to President Akufo-Addo to EC and everybody, they all don't care about the lives of citizens. I don't think so. It's about observing the preventive etiquette.
Is government tired of fighting this pandemic?
Government is not tired of fighting this pandemic. Government is committed to the fight. 5-part strategy, doing very well. One of those pillars, we need more public participation. This argument of tired came up because the minister responsible for health, speaking in Bono in Doma, was admonishing people about, and in his words, he says the tireless efforts that the president and the government have put in. And he argues that as it was being translated, it was translated to mean that the government is tired. No, the government is not tired. We're committed, but we need citizens to also rise up to our responsibility so that that last mile, we can close it.
We're grateful for your time. We'll leave it here.
Thank you.
Information Minister Kojo Ponkuma. I wish we could go on and on. There are loads of questions. Thank you so much. And that's it for tonight's edition of Beyond the Lockdown. I am MF Apo.